Hi there, nursing students. I'm Professor Carew, and I received a request to review sepsis. But sepsis is a lot, and so I wanted to break it in parts. And so I'm going to start with pathophysiology, then I'll do signs and symptoms or clinical manifestations, then I will get into treatment, and then I will get into diagnosis, and then I'll get into nursing priorities. Not in that order, but I'll break it up so that it's more manageable. So let's talk about the pathophysiology of sepsis. So sepsis starts with an infection, and this infection triggers a massive inflammatory response throughout the entire body, and the immune system will release inflammatory mediators to fight the infection. But these chemicals that are released can also cause damage to the body's own tissues. The first major effect that's seen is vasodilation. There is massive vasodilation. And due to the blood vessels widening or increasing in diameter, blood pressure will fall. And so patients have hypotension or low blood pressure. As blood pressure falls, less oxygen-rich blood is delivered to the organs. The next thing that happens is capillary leak. The blood vessels become very leaky, capillaries become very leaky, allowing fluid to shift or move from the bloodstream, right, from the intravascular space to the tissue, that's the surrounding tissue. The fluid stays in the body, it's just not in the vascular space. It's no longer available for circulation, and so tissue again is not perfused. The inflammatory response also activates the coagulation system, leading to microvascular clotting. Within the tiny blood vessels, in those little tiny blood vessels, blood clots form and they block blood flow, making it very hard or even harder for oxygen to reach tissues. So now we have three problems. We have vasodilation, we have capillary leak, and we have microvascular clotting. And together, these three here, together, they lead to tissue hypoxia. So tissue hypoxia is when tissue is starved of oxygen. There's not enough oxygen getting into the tissue. And when this happens, anaerobic metabolism occurs to try to make oxygen for the tissue to function. A byproduct of anaerobic metabolism is lactate. So lactic acid is a byproduct of anaerobic metabolism. And so you'll see when patients have sepsis, lactate levels will rise. And elevated lactate is one of the most important indicators of poor tissue perfusion. And I'll say it again, an elevated lactate is one of the most important indicators of poor tissue perfusion. So what happens next? Well, organs will try to compensate, so the heart will beat faster in an attempt to maintain cardiac output, resulting in tachycardia, right? So remember, cardiac output is equal to stroke volume times heart rate. When stroke volume drops, heart rate will increase. The lungs will breathe faster in an attempt to compensate for metabolic acidosis. And you're saying, well, why is there metabolic acidosis? Because of anaerobic metabolism, lactic acid. The brain receives less oxygen-rich blood, leading to confusion and altered mental status. The kidneys receive less blood flow, resulting in decreased urine output and increased creatinine. And without treatment, tissue hypoxia progresses to organ dysfunction, septic shock, and potentially multi-organ failure. So the key concept to remember is this. Sepsis is not dangerous because of the infection alone. Sepsis is dangerous because the inflammatory response causes poor tissue perfusion, tissue hypoxia, and ultimately organ dysfunction. And that's the pathophysiology in a nutshell of sepsis. If you like this content, please follow, please share, and stay tuned for more.